160 hours will be available for July and August. For email is in the chat if anybody needs it.
All right, let me start again with recording, and can you guys all see the slides? Is that a yes?
Yes, we can see the slides.
I'm gonna, I'll see the slide.
Great. And is it good for me to present from here? Or would you like?
Yeah, that's fine.
Okay,
That's fine.
great. So, Kelsey, thank you so much for the introduction. My name is Clara and it's a pleasure to be here today. I'm an evidence-based birth instructor and birth doula. And I absolutely love collaborating with Worcester Act. It's a pleasure to be here today. I worked and lived in Worcester for quite some time, moved to Atlanta for about 3 years and moved back 6 months ago. So it's great to connect back into the community in Central Mass. So feel free to progress on to the next slide. Today, our goals are really getting understanding of how our experiences really shape our thoughts, our feelings, and our behavior, and recognizing that when we have unaddressed trauma, those can have long-term life consequences that can sometimes be negative consequences or challenges as we're navigating our lives. And lastly, understand how this could show up for folks who are chest or breastfeeding in their journeys as well. And we can progress to the next slide. So before we dive in and talk a little bit more in depth about trauma, I do want to talk about the fact that there is a lot of stigma around mental health and mental illness. So there's a funny little cartoon on the slide that highlights, you know, when we see someone who is saying, you know, I feel like I'm dying when it is a physical illness, you know, we take that so seriously, right? We say, okay, let's get you help. Let's get you to a professional, a medical professional. Let's get you to the hospital. When we see that happening with mental illness and someone feels as if, you know, they feel like they're dying, you know, a lot of times the response is not the same. You know, well, compared to someone else, you might not have it so bad. Or, you know, this might all be in your head, and kind of minimizing that. So there's a few animations on this slide. So if you, I think you click the slide maybe 3 more times, they'll appear. So stigma is basically a sense that carrying something or maybe having a mental illness is going to in some way create some sort of disgrace or stinging your reputation in some way. So basically what happens is stigma becomes a huge barrier in having folks actually seek the help they need to get mental health supports. And there's one more, yes. So we know that many people would actually prefer to tell their employers that they are spending time in jail or incarcerated instead of actually saying that they have gone to a psychiatric hospital, right? So that's the stigma we're dealing with mental health. And that's the stigma that people who may have experienced trauma in their lives and having mental health impact are living with on a daily basis. The stigma around how will people view me, how will people negatively judge me as a result of having mental health challenges. So on the next slide, I just want to highlight that a lot of times we don't view trauma as what it is, which is basically a mental health injury, right? So if we can look at it like we look at physical health, if you are injured, you need support. If you have experienced trauma, you also need support. So psychological trauma can happen on a chronic basis, or it can happen at one point in time. But it's something that can sometimes impact someone's day-to-day, everyday experience. So it basically activates our stress response. So all of us as humans are wired to have a fight, flight, freeze response. Now, if we were in the wild and exposed to a predator, right? Say we were in the wild exposed to a lion or a wolf, right? Our body assesses that we are under stress and under threat, and it's gonna try to figure out the fastest way to get us out of that situation. And in the wild, the best thing to do would either be, can we fight this predator? Can we outrun this predator? Can we get away from it? Or can we freeze and have it not recognize that we're there, basically? Now, the fight, flight, freeze response is also activated if you have a trauma history, right? Because your brain is processing under this stress that your life is in danger, right? So instead of being able to think and clearly and look at different processes and kind of the impacts of your actions, you're going into the stress response of fight, flight, freeze, which is not as advantageous if you're not actually confronted with a wolf or a lion or a predator in a life-threatening situation. This could happen getting exposed to a really loud noise in a subway, right? Where you're unable to use your brain and functioning in the same way. So, in the next slide, we'll talk a little bit about the types of trauma that are common. The first thing to know is trauma is actually extremely, extremely common, and a lot of us don't think that. There's a lot of research that came out around ACEs, which are adverse childhood experiences. And adverse childhood experiences typically fall into 3 categories. So there's abuse. Abuse can come up in the form of physical, mental, or sexual abuse. Neglect, that can be physical or emotional. And then there's household dysfunction, which includes having someone who is struggling with mental illness. It includes having someone in the family who is incarcerated or out of the home for a long time. Even military deployment can be included in that. Seeing the mother or caretaker treated violently in the home, substance abuse, and even divorce are also areas where we see their categories as adverse childhood experiences. So according to the CDC, over 50% of Americans are estimated to have suffered from at least one traumatic event in their life. So we see 1 in 5 Americans have been sexually molested as a child. If they're living in institutional settings, we know that rate's a lot higher. 1 in 4 Americans have been physically beaten by a parent, right? To the point where there have been physical marks left. 1 in 3 couples engage in physical violence, and 1 in 4 people grew up with an addict or had an addicted relative, right? So that's struggling with substance abuse. So trauma is extremely common. A lot of us deal with it in different ways. A lot of us don't recognize that maybe we have experienced trauma. A lot of us may have forgotten it. It's stored in a nonverbal part of our brain. But the important thing to know, and we can move to the next slide, is trauma is caused by a lot of things. We've kind of talked through the categories, but it includes child abuse. It could be an accident or injury that could be life-threatening. It could be non-life-threatening, but having impacts on your life. Experiencing domestic violence, the chronic stress that happens from poverty and food insecurity. Having a beloved caregiver pass away and no longer be there to offer supports. We know systemic issues like systemic racism, sexism, heterosexism, and homophobia. Those are all also areas that cause chronic stress and trauma in people's lives. Physical abuse and assault, as well as forced displacement. So that could be either experiencing homelessness or that could be living in a refugee camp. We know police brutality or being treated with cruelty can also be sources of trauma. And then witnessing any of these things happening to other people can also be trauma as well. So it doesn't necessarily have to be you experiencing those, witnessing any of these things happening are also considered traumatic events. So on the next slide, I want to bring this back to birth, right? So according to the National Institutes of Health, 45% of people giving birth are experiencing some form of birth trauma. Now on the next slide, let's talk a little bit about how we break that down, what that looks like. So research that came out in 2017 is showing us that the majority of people who are experiencing birth trauma are experiencing it for 4 main reasons. And a lot of people might think, oh, people are experiencing birth trauma because birth is dangerous, or birth is, bad birth outcomes, but that is absolutely not the case. As a birth doula, I confidently say birth is not an inherently dangerous event. But we know in terms of birth trauma, that it's coming from mostly a lack of agency, losing a sense of control in the birth process. And that is directly related to the fourth point there, that is also a lot of times interactions with caregivers, mostly around interventions, can be a source of challenge. Not being fully informed of what your options are, not feeling like you have options, kind of again, leading to that lack of control or bodily autonomy. And then areas of fearing for the baby's life, or the baby's health, or not being able to manage the intensity of the physical discomfort and figure out a way to manage that in a way that is ideal. So those are areas that can cause birth trauma. And we also know that folks who have traumatic histories can have that resurface in the birth environment, right? Because we know birth is an inherently vulnerable time where you need to feel supported and taken care of. And a lot of times that sense of vulnerability, especially for folks who are survivors of sexual assault, can be very, very, very vulnerable and often bring up a lot of feelings, emotions, and can even be re-traumatizing if not very intentionally managed. So on the next slide, what does trauma look like? Like if someone has trauma, how do we see that actually play out in people's lives? Well, a lot of times people can feel shameful. They can feel like they are inherently broken or bad and really start to internalize this. Now, we know from Brene Brown's work, if you're familiar with Dr. Brown, a lot of her work talks about vulnerability, it talks about shame, it talks about how we interact with trauma and really create resilience in our lives. And what we know for a fact is that if you put shame in a petri dish, it needs shame and silence in order to grow exponentially. When we're not talking about our trauma, when we're not talking about what we are feeling inside, we become more isolated and we allow that to grow. But when we start to douse shame with empathy and connection, it cannot survive. So understanding that our roles as care providers, our roles as public health professionals, our roles as birth workers, making sure that we're showing up in a way that allows people to know that we're a safe place to talk to, that we are sharing, an empathetic approach to our work, helps take away that sense of shame, the sense that I'm bad, there's something wrong with me. A lot of times people who have experienced trauma can also react in a way that they struggle to see their options, right? Sometimes tunnel vision can come up, not really being able to see the broad scope. Again, when we're in a fight, flight, freeze response, our brain is not looking at all of our executive function skills, right? It's looking at how do we quickly react and move through a situation. It also can show up as people getting really easily overwhelmed, maybe not having a lot of confidence, and they're constantly working in survival mode. It can cause difficulty with planning ahead, sometimes having a distorted sense of time. A lot of times it can also result in not having kind of clear memories or having memories kind of not on a chronological timeline or feeling a little bit jumbled. Emotional regulation can also be an area of struggle for folks who have experienced trauma. And oftentimes feeling like you've lost a sense of control and having a response where you just kind of shut down can also be a common response. So folks can sometimes feel that they're unsafe or they're being attacked very easily. And a lot of times it comes into starting to blame themselves and feeling like they deserve the hate or the pain or the hurt that they're experiencing in life. Basically, trauma has taught them to use distrust as a coping mechanism and really lean into being a little bit more skeptical about the supports around them. So on the next slide, the trauma can also have a really delayed reaction, right? So sometimes we think, okay, someone has experienced something and they're going to have kind of an immediate trauma response. Sometimes people will have an experience of trauma in childhood, adolescence, early adulthood, and that doesn't show up until much later in life, right? So it can show up and it be triggered by being in a romantic relationship. In the United States, when we're talking about chest and breastfeeding, we know that breasts are sexualized, right? If someone had, any form of trauma or sexual trauma, you know, we know that interacting with chest or breastfeeding, just based off of how someone may have experienced assaults in their lives, that can be triggering, and it can bring up memories of an assault. And a lot of times, people don't realize we have blind spots. Again, our brains are very smart, they're not processing that we have experienced trauma, because it's a survival mechanism. So it might be that something feels off, but we can't necessarily articulate or figure out why it's feeling wrong or off to us. So with that, I do want to also talk a little bit about intergenerational trauma and how that impacts chest and breastfeeding, and that on the next slide, particularly for BIPOC parents. So when we talk about trauma, we also will be talking a little bit about intersectionality. So trauma shows up in a lot of different ways, but we did talk about how racism, sexism, homophobia, all of these systems and prejudices also have impacts on how our society is structured and how people are getting supports or not getting supports in our community. And when we think about intergenerational trauma, I think it is really helpful to highlight the fact that enslaved African women for a very long time were in fact forced to be wet nurses for white babies. And a lot of times this was dehumanizing, it was stripping them of bodily autonomy from their own breasts, and oftentimes they were physically separated from their own children. So we then couple that with, in the 1990s, the formula companies also targeted Black women in their ads, leading to enormous profits for white-run formula companies, but also, you know, we know that breast and chest feeding is learned, it is not instinctual. Babies, yes, can instinctually suck, but it is really important to make sure that years and years of information and nuanced technique is taught by professionals now, but it used to be passed down through families. And I highly recommend the book, The Big Letdown by Kimberly Seals-Allers. It talks a lot about how all of these systems at play really did impact the Black community in the United States in their chest and breastfeeding journeys. So it's important to understand that when we are thinking about trauma, a lot of times these challenges stem from years and years back that have impacts on how families then taught their children how to manage breast and chest feeding, right? Because it was seen as something that was shameful or dirty, or it's a survival response to not have to continue to just or breastfeed. So it's important to understand that there are contexts here that impact different communities in different ways. In the next slide, I do want to just highlight this concept of intersectionality, which is basically different identity groups that we belong to have different stressors or stigmas associated with them, right? So how we navigate this world based off of different systems and different ways in which identities are treated in our society also impacts the level of trauma or our propensity to experience trauma. We know that there are, you know, systems of oppression and challenges in our country in many different ways, around gender, around race, around sexuality, around ability and disability, around nationality. And so we know that people with different identities can face a lot of different barriers or experience poverty because of systemic barriers, or experience, interpersonal violence on higher levels due to the ways that identities are treated in our society writ large. So it's important to realize even positional power within our lives can impact that. So understanding that when we think about trauma, it's not necessarily, a lot of us think, oh, child abuse, like someone was hit or sexually abused. We don't think about the chronic sense of trauma, what that comes with oppression and that comes with poverty and things of that nature. So it's important to know that identity does matter when we are understanding and unpacking trauma. So, next we'll talk a little bit about some, symptoms that someone who's experienced trauma might experience, right? So, a lot of times we see trauma symptoms of avoidance or, so avoiding activity, avoiding something that might be triggering to them. Sometimes there's hyperarousal, right? So either hypervigilance or really getting startled easily. Maybe it's feeling too much, like again, that hyperarousal or being very sensitive or feeling too little, so being a little bit numb. We can also see disassociation happen a lot for folks with who experience trauma, and this is something I would say comes up a lot if you are working with folks who are chest or breastfeeding and have experienced trauma. What happens when you are all of a sudden spending hours a day feeding an infant and having to be extremely present, you can't distract yourself as easily and kind of push down maybe feelings that you may have experienced or past traumas. Being ever present with the baby who doesn't have a past or past or future association, they're constantly present, they're telling you exactly what they need, their immediate needs. Having to stay in the present and also deal with your present emotions can be really hard, especially with folks who've commonly fallen into dissociating in order to get themselves through anything that might be triggering a traumatic response for them. We also might develop defense mechanisms to protect us from being aware of a feeling or a thought that we can't tolerate. So a lot of times what I do in talking to my clients who have trauma histories and preparing for breastfeeding is kind of a series of questions, right? First of all is getting curious with what you're feeling. And, you know, how is what you're feeling maybe similar to the traumatic experience that you're healing from, right? So it might be, for example, someone was, you know, breastfeeding their baby and they're feeling this feeling of being trapped or not having their emotions met, or you know, something might be coming up, and asking them, okay, how is this similar to maybe the traumatic experience that they had before, and then asking the question or telling themselves, you know, while this is similar, it is not the same. And I'm okay in this moment, right? And obviously then seeking out mental health support to begin to really process, you know, what is coming up in this moment and how is this being triggered by my current lived experience in feeding my newborn. So a lot of times, you know, these symptoms are related back to the trauma that we've experienced, and it can happen on a very micro level, like a very little experience. It can happen, you know, in general systems and how our life is organized, and it can happen, you know, on systems level with systems level oppression as well. So let's dive into some triggers that can cause people to maybe elicit some of those trauma responses. One is, you know, reacting to someone who has an intense or unexpected emotional response, right? It could be a person, a place, or a thing that reminds them or triggers them of a specific moment, right? As people who are offering care, it's sensitive for us, you know, realize that it might not have anything to do with us, but we might remind someone of someone who, you know, was an aggressor for our client, our patient, our friend. Sometimes it's sensory experience, right? It could be hearing a song that reminds you of a specific moment, or a smell, or even a texture. It could be, you know, very unique to an individual. So all of these things can elicit that trauma response. And when we think about chest and breastfeeding, it could be, you know, even the sensations of, you know, having folks trying to help you with managing positioning with your newborn, and having someone touch that area, for the first time after that, or having someone who you haven't developed a long trusting relationship with, doing that, right? Feeling very exposed. So it's important to know that sometimes someone who has a trauma history, you know, can shoot the messenger in the sense where they might react to the person who's trying to support them in their chest or breastfeeding journey. But ultimately, it's coming from a deeper place of hurt. It's not coming directed, you know, not directed at you as an individual. So on top of those triggers, I also want to highlight that we have a lot of societal judgment around infant feeding. Like, it doesn't matter if you have chosen to chest or breastfeed your baby, or supplement with formula, or formula feed your baby. Regardless of your choices, people are going to judge you, right? And I think that judgment and the societal messages that new parents get can be so overwhelming and can be so triggering. So lactating individuals are often judged or shamed for choosing to breastfeed because their parents didn't and they formula fed. They could be judged the way that they're choosing to feed the breast or chest feed their baby. If they select formula, they're being told that that's not good, right? You're in a situation where any option that you choose can be faced with judgment, and that can cause isolation and shame. And what did we talk about earlier? We do know that in general, there is stigma and there's a lot of shame when it comes to trauma. So if we're putting folks in a place where maybe they don't have a trauma history, or maybe they had a traumatic birth, or maybe they do have a traumatic history, and we're putting them in a situation where they're feeling judged and isolated again, what type of situation are we cultivating there, right? So it can be very, very challenging in navigating this new world and this new way of feeding our infants, when no matter where we turn, someone's gonna have an opinion about what we do, right? So as we think about things, what can we actually do about this, right? And so, as we move on, I think the first thing that we want to talk about is, building resilience, right? So in order to build resilience, we need to think about basic needs first. And if anyone has experienced postpartum or works with folks who are in the postpartum phase, we know that it's all about having basic needs met, and it sounds silly, but ensuring that folks are getting their basic needs met. Postpartum is a time that requires so much support. I often tell my clients, like, your priority is sleeping, eating, not cooking, eating, feeding your baby and bathing. Like, those are the main things that you need to focus on. But if you don't have supports around you, that is absolutely impossible for someone to focus on, right? So making sure that people have their basic needs met is a criteria for someone to be able to heal and to feel grounded and either be able to not be triggered by a traumatic event and eventually address it, or have the capacity to begin slowly uncovering and healing those wounds, right? We also want to think about external cleaning or decluttering. Like, what do I mean by that? It's not like, okay, we need to declutter your home. We need to declutter all the million and one things that you have on your to-do list that you have to figure out how to do. So postpartum, if you need mental health support, or if you need lactation support, well, trying to find that has a lot of barriers to access, right? So how can we declutter the direct access people have to getting a postpartum doula, to getting an IBCLC to come to their home, to having virtual mental health support, right? We need to start to declutter the access to support, and the access to basic needs being met. Life exists in our mind, right? So a lot of times examining the thought and getting curious about what's coming up for us can be very, very helpful, but it can also be challenging. And that's why being really mindful and trying to live presently can be a great resource for folks, but can often be a little bit hard to get to, when being present brings up a lot of emotions. And then starting to practice gratitude, finding humor in things, building a support network, and working to heal is also a journey in being really gentle and kind to ourselves, right? I'd say what I would suggest that my friend does and how I talk to my friend is a lot nicer than how I talk to myself. And I have a feeling that all of us experience that. We tend to be our own worst critic. And so knowing that healing takes time, it's a journey, it's not something that we can just put a Band-Aid on and think it's gonna heal in 2 days. So being gentle and kind with ourselves in this journey is so important. Now, next, we're gonna talk a little bit about the fact that a helping relationship can be a game changer for people. The helping relationships are considered a protective factor that can actually lessen or undo the effects of trauma. So strong, kind, loving relationships, they build resilience. They offer role models, so basically a new normal for folks who maybe haven't experienced a healthy and caring relationship before. It encourages healing, and it has more effects than any other type of treatment, right? Having a dependable, supportive, healing relationship is key. And if problems arise in that relationship, someone is able to heal it, right? That interpersonal connection and growth together, right? So this can really help folks it can help folks experience growth from trauma. So factors of supportive relationships encourage unpacking, reflecting, and talking to someone, right? It replaces the negative messages that might be in your self-talk or might be in what other people have been saying to you, you're too much or you're too difficult or whatever it might be. Replacing it with better ones, more accurate ones, more kind language. They're founded on communication, non-judgment, being genuine and empathetic. It's really paying attention to a person's concerns and feelings and really believing in someone's potential to heal, in their inherent potential to grow, and cultivating a person's own resources, right? So building community, a supportive community, more supportive friends, connection to resources that are going to help someone. Now, when we think about immediate postpartum, we're thinking about the birth space. There are a few things that we can think about that can help people in the time that they are new parents. And, you know, if you are in the birth community, you know that immediate postpartum, we know skin to skin birth, even including after cesarean birth, has been proven in the research to have immense impact on both the birthing person and the baby. The nervous system of the infant and the birthing person have not been fully separated yet. They're still connected immediately after birth. And so having that separation can be really challenging. So whatever we can do to maintain that infant birthing person dyad is crucial. So that starts with immediate skin to skin. We know that the benefits just for the birthing person impacts a longer duration of chest or breastfeeding. They're also more likely to exclusively breast or chest feed. They're less likely to experience engorgement and pain at 3 days postpartum. There's less anxiety after birth, and overall they have higher satisfaction. We also know that there are drastically great impacts for parents of color. It highlights that providing skin-to-skin care after cesarean was significantly associated with higher rates of starting breastfeeding or exclusively breastfeeding. And that was the greatest impact among Black infants. And we mentioned earlier, due to the history of slavery, due to the history of formula companies targeting the Black community, we generally see lower rates of breastfeeding. And so we do need to be intentional, right? Black babies who roomed in with their parents were more than 1.5 times more likely to exclusively nurse than babies who didn't. And Black babies who had skin to skin after a cesarean, we're 1.6 times more likely to exclusively breastfeed while in the hospital than babies who did not. So these seem very simple, but they are important elements to promote breastfeeding and also to mitigate trauma as well. And next, we'll talk a little bit about systems change, right? So we know we'll want to do everything we can to try to prevent birth trauma, because we know that that can re-traumatize or traumatize someone for the first time. So more childbirth education is a great preventative measure, making sure that there is informed consent and informed refusal, removing pressure from the decision-making of the birthing person, and ultimately honoring their right to bodily autonomy and their ability to choose what they want to do in their birth experience. And having more birth and postpartum doula support can be a great strategy as well. We also want to see more support for new families. So let there be postpartum home visits, right? We go from having so much support prenatally to a vacuum postpartum. And so meeting families where they're at, having built-in lactation support, connection with lactation support groups, and also access to mental health supports are huge. Seeing longer parental leave also makes a difference. And then systems of support in general for trust and breastfeeding. So making the resources more accessible, also prenatal education around infant feeding is huge. And making sure that our professionals are also trauma informed. And lastly, I want to highlight the fact that the change really starts with you. And I want you to really know that how we approach this work matters. And the first thing that this includes is making sure that we're practicing self-care and self-compassion. So we're doing our own work to stop the cycle, because the chances are many of us, and I think we don't have research on this, but my assumption is folks who are in the care and caring for others in that industry, at least from being in this role, have higher rates of having experienced trauma. I think folks realize the power of healing relationships and tend to gravitate towards this work. So having self-care and self-compassion for ourselves is important. And it has a generational impact, it has a ripple impact for us and beyond. So living with awareness, being present in our own lives, is basically the best predictor for success. And people who are doing this work, we're doing the best we can, and recognizing that we're always learning and we're always growing and we're always moving forward is so important. And there are also huge rewards for caring, right? So it can feel great to be feeling like you're useful, you're helpful, you're important. It helps us see the good that exists in our own life. And it can also really help us in our own trajectory. It can be a spiritual work, it can be soul work, it can be something that really fulfills us in feeling like we have a higher purpose as we're navigating support for folks who need it. And so my kind of last slide directed at this is highlighting, remember your power. We have so much power. Every single interaction we have with someone is powerful. And so remembering that you're possible of anything. When we set goals and intentions about how to serve and care for people, that makes a huge difference. What we put our attention to grows, and what we put our attention to has power. So know that you are also worthy of belonging and you're worthy of love. The impact that you have is exponential. Be gentle with yourself. The world is a better place because each and every one of you are in it and you're curious about this work. Anyone who's watching a presentation on how to support folks and have a trauma-informed approach to lactation clearly cares about individuals deeply. So knowing that you are already you're on your path to doing this work so well. And I'm just really honored to come here and speak with you all today. So the last slide highlights some resources that can be helpful in the future. So a lot of them are very trauma specific. I think Evidence-Based Birth is an organization, I'm an evidence-based birth instructor, so of course I'm a little biased, but they do a really great job of kind of blending the research with practice and being very trauma-informed in their work as it relates to birth. And then I also do want to highlight that the Postpartum International Support Helpline is also a terrific resource for folks. They also have text hotlines as well in both English and Spanish, making sure that if you're working with new families, that they have access to this. They have terrific support for anyone who is in crisis in terms of mental health in the postpartum phase and connecting them with the resources that they might need. And then lastly, to wrap up, we of course will have time for questions if you have any. But we would love for you to offer your feedback on the session today. So there's a QR code if you are able to scan that and just share your thoughts about the presentation today. We'd be extremely grateful for your feedback. We're always looking to improve and learn how we can do this work better and further support you all. So thank you.
Thank you so much. What a wonderful talk, and you get right to my, oh, thanks Kelsey, put the feedback link in the chat. So if it's okay, I'm gonna take down the screen so we can see our results. Is that okay? All right, really appreciate that. And I mean, you are amazingly able to follow the time guidance that I gave you, like to the second, I think. So thank you so much. What a great talk. I know I have some questions, but I'll start with opening the floor to people in the audience. Any questions for our speaker? Or comments? All right, I'll start. I was struck by the first thing of the issue of birth as being dangerous. And I think that what I've heard from some of my colleagues of color, taking care of women of color right now, is that they are hearing the messages out there that Black women die more, and they are perceiving birth as dangerous because of that. So I do think we have to incorporate that into our thinking. And, even though some numbers tell us it's not as dangerous as it used to be, there's a lot of publicity that it is dangerous for Black women. So I think we have to kind of be able to incorporate that into our counseling. And I don't know the best way to do that, but
Yeah, and I think you bring up a great point, and I agree. I think my statement was definitely generalized there. I think we do know we're seeing huge disparities for Black women in the United States. And I think a big part of that is that our systems are not set up to care and prevent in the same way. A lot of what we're seeing is very preventable things, and not being taken care of, right? So I think the challenge, I think, in our society is that we have a very fear-based system when it comes to childbirth. I think that narrative overall is stressful for people. And I think approaching birth from a fear-based narrative can be really challenging. But I think a lot of work needs to be done to ensure that we have the advocacy supports needed for birthing folks of color. And also making sure medical professionals are getting implicit bias training and our systems are structured in a way that are much more supportive for getting the care needed for families of color that oftentimes is not provided in the same way. So it is important to recognize that advocacy is huge in entering kind of I think a flawed medical system that's not serving families equitably.
thank you.
Yeah.
Dr. Johnson, you have a question?
Yes, thank you. I just wanted to piggyback on what was just said. First of all, that was an excellent presentation. I really, really appreciate the trauma-informed lens. It's so crucial to how we move the dial forward in this space. And just to piggyback on what you've just said, I think that's the strength of the opportunity that we have right here is to really take a multi-pronged approach, which involves all of us really leaning in with intentionality to one, how do we increase greater diverse representation among our care providers delivering care? Over the past couple of years, actually it's been going for the last couple of decades, but it's really accelerated in the past couple of years, the kind of evidence that's being published clearly showing the connection between culturally and racially and linguistically congruent care as informing and improving outcomes for populations who have been marginalized and oppressed, especially as you mentioned, that intergenerational trauma is so crucial. And there was one study that was just published this spring that even showed that in an entire county where there is a higher proportion of providers, caregivers of color, the entire care of that community is elevated, even if an individual patient who is minoritized is not cared for by a provider of color. The ability for us to elevate care for an entire community is impacted. So I think we have an amazing opportunity here in Worcester to really lean into that with intentionality, especially with like the doula program that's being launched at UMass Memorial, where we're really centering how do we nurture intentionality by increasing the perinatal birth worker workforce to actually represent the communities we're trying to serve in terms of linguistically inclusive and racially and culturally congruent care advocates, partners who can help in building that essential trust, which is so crucial. In addition to everything they said in terms of, making sure that our institutions, right, have a nurture culture of inclusive access, making sure that the care providers, are also not experiencing their own biases and microaggressions, just trying to deliver care. It requires leaning into all the different spokes of the wheel that intersect. And I love the way that you talked about intersectionality. It's so crucial because it truly is a multi-pronged perspective to not only lean into the patient's lived experience, but the systems and structures that are in place that often perpetuate harm, even if we as individuals are seeking to do good work, right? So I really love this, and I really think this is so exciting and an opportunity for us as a collaborative, right, to lean in to really amplify and really lead in this way as an exemplar for the region and the Commonwealth and even the nation.
Couldn't agree more.
Thank you so much.
I have a question. It's a little bit different, but I was at Tufts University, been only here for 3 months. And the last part of my work was working on purpose, belonging, and well-being. So here's my question, because I understand what you're saying, but as I talk to young people around, and not to get political, just the way the world works. It looks like it. If you look at climate change, you look at politics, you look at this. So is there a piece with people looking and saying, what have I done bringing someone into this world? Look at poverty, look at my education piece, look at all this, and kind of, because my daughter was born right around 9/11, right? And one might have like, oh my goodness, what is she walking into? That seems, not being political, but on the news, it seems like the world's on fire right now, literally and figuratively. So does that ever play in what you're seeing in people saying like, what have I done here, or how can I protect this child, and I can't protect myself?
Yeah, I mean, I can't say anything that I know from the research per se on that specific question. Speaking from my own experience in my generation, I think that's a question a lot of people are asking themselves as they're deciding if they want to have a family or not. But we certainly know that environmental stressors have an impact on us and also can impact us in traumatic ways. We know that climate change is creating, higher levels of forced migration or, access to resources in very different ways. But we know that we're gonna experience more food scarcity. So I can't speak to kind of that, the parental concern of did I do the wrong thing about having a kid as our, world is becoming, more and more challenged, but I certainly do think that we have a higher likelihood of experiencing challenging environmental stressors that can be traumatic, and that's certainly likely be a question that people are faced with. Yeah, I'm sorry, I don't have like a more concrete answer,
No,
but
I-
my assumption would be yes, I think
Yeah.
people are asking that question. And I think the more we see, different challenging things in the news and, in our communities, that naturally kind of brings up those questions for people too.
Yeah, because I can understand the trauma thing, and then you just open the newspaper, and then I can see how that could reinforce,
Oh, yes,
all
yeah.
the things that you believe,
Mm-hmm,
and I see it's hard enough raising a child and all that without thinking,
yeah,
personal trauma, actually needs to be out there, so.
definitely.
Okay.
Yeah,
Yeah, I think as I think about some of our, families in our current place with the migrants and the housing crisis and all that families, who are in the middle of quite a bit of trauma and crisis themselves, regardless of what the world is happening out there, their own personal life's traumas are pretty intense. And so how to help mitigate the fear and anxiety that generates in the moment of them giving birth and having this new child to help, move ahead, and how to protect their children from the life that the world they've suffered so much in already, and, so. Thank you. Any other questions from the audience? I do have another question, and this is a little more specific. You mentioned about the societal judgment about lactation issues and lactation choices, and I certainly, I see that in my practice, and I struggle a little bit because how do I counsel my patients about, breastfeeding and the evidence base around the things that I know help support that in a place where society so undermines lactation? For instance, the lack of prenatal education, the lack of the sort of misinformation that people have about it, the poor hospital support in those very important first couple of days after
right.
birth. And I want to sort of mitigate some of that in my counseling without sounding judgmental. So do you have any suggestions for how to balance that out with, like, I want to support your choices, but in fact, everything that's happened to you so far in the hospital is undermining those choices? And how can we kind of pull back from that and move things forward?
Yeah, first of all, I can deeply empathize with your experience, especially as like a birth doula, and I kind of like see things sometimes like get out of hand, and it's like, I don't even know how to get back to track and like talk about how many steps were taken here that kind of got you off track of where you wanted to go that didn't necessarily need to happen, but you thought you were making the best choice because whoever was with you was telling you that that was the case, right? I think trying to take a very individualized approach and asking what their priorities are, right? And starting with making sure that the person you're working with knows that you're here to support them in whatever their goal is, and to make them feel as grounded and supported as possible. I am very, very familiar with the benefits of Chester breastfeeding, right? Like, we know that human milk is magical. We can't make this, the same chemical compounds that is constantly changing to meet a baby's needs in a formula. We just can't match it, right? But I think when working with someone, them knowing that, you've got them, and no matter what they do, you're gonna support them. And starting with what are your priorities, and what are some of your goals, and what's important to you? And I think what's hard is we know that their journey up to that point might have a lot of lack of education in terms of the benefits of human milk, right? But trying to meet families where they are as much as possible, and just taking it from an approach, I'm here to support you, what are your goals and how can we support you get there? Tends to be an approach that someone will be like, oh, someone who like really is listening to me, not And in that, you also invite a deeper level of trust where you might be able to have a candid conversation with them as you develop the rapport of how things might be better if, you know, their goal is to exclusively chest or breastfeed through 6 months or a year, or, then you're able to share some resources there. So I think starting at that, let's have a conversation about what your goals are and how can I best support you. Build the trust there for you to then have deeper conversations, opposed to, well, I know people are telling you this, but you're already doing this wrong, which is not what you're saying, but might be what they're hearing. If we go in immediately and kind of say, well, this is actually what's best, right? I don't know if that helps.
Yeah, no, thank you. I've been trying to really help my residents and learners, start with the question, what are your breastfeeding goals and what can we do? Like, so basically,
Mhm.
that's where I've landed, and I appreciate that you're saying that publicly, because I sometimes feel like I'm the only one saying it. So-
Yeah.
That's what I think too, because that's approach we use for universal visits, so at least from our end, it's
We're sort of
consistent.
parallel,
So
yeah.
that's good.
Yeah.
Great. And then the only other thing I thought about was, I'm gonna be a little bit of a devil's advocate here, only because I worry a little bit when you mentioned the idea of promoting more childbirth education as a way to reduce birth trauma. I'm not sure the system is ready for yet, and this will speak to, I'm gonna be hopeful, like, I'm gonna channel Dr. Johnson at Baku here and be hopeful with this opportunity that we have, but if we are teaching a lot of evidence-based birth and empowerment and all of that, and then the person enters a system that isn't quite there yet, they're actually maybe set up for more birth trauma if their sort of hopes and expectations around what's gonna happen for them in birth are not met, because the system isn't ready for that yet. Like, I wanna keep working on the system, but I don't wanna set people up for failure and lead to more psychological trauma because they thought that I took this class and I'm gonna be ready for it, I'm not gonna, like, I guess, so how do we, again, how do we sort of balance
Totally
that?
understand where you're coming from. And as a childbirth educator, I see a lot of curriculums that are ultimately really polarizing, right? They're like, this is the best way to give birth, and this is like the information you should know. But like, doesn't really talk about all of the choices and options and that you have agency. I think my approach to childbirth education follows the pillar of making sure that you know what your options are. And you also know that you are the one making all of the decisions, right? So I think even if you're in a system that is not fully practicing evidence-based care, if someone takes a childbirth class and fully is aware of what their options are and is able to recognize that they are the person in charge of the decision-making in their birth experience, regardless of the level in which the system is ready, you know your rights and you're also able to advocate for those in a way that is much more grounded, right? I think a lot of times I see people taking, the cheap, like, childbirth education course that doesn't really talk about interventions and is like, yes, a good birth looks like X, Y, and Z and is unmedicated and like doesn't go do all of these things, right? So then someone gets into a system where birth is not managed like that, and all of your interventions are presented as policies that you have to follow as if they're laws, opposed to options and an à la carte menu that you can choose from, all of which have benefits and risks, and your perspective is valid in choosing, is this something that I find beneficial, or is this something that I find risky for me? I think what the change might need to be is making sure that our childbirth education is honest about the fact that 80 to 90% of professionals are not practicing evidence-based care, and how we navigate a system in that way that feels good to us. I think it's complex. I think it's challenging. But I do think that it's more harmful to have someone go in blind, unaware that they have autonomy and agency and be put on kind of one track, versus you have these options, these are going to be recommended to you, at the end of the day, it's your choice what you do. Remember, you know, what my goal is for at least my students and my clients is we can't plan a birth, right? Birth is unpredictable. We can plan for birth and we can have a lot of different understandings of scenarios, right? Like, this is my spontaneous labor plan. This is my induction plan. This is my gentle cesarean plan. Like, these are the options that are important to me if any of those things happen. But at the end of the day, need to make sure at every decision point, you felt in control of the decisions that were being made. That's what's going to reduce birth trauma. Releasing expectations that work have to look a certain way, but certainly putting a client's voice in the center. This is how I'm making this decision. And I am the center of who's deciding what happens to this birth, I think is what can mitigate some of that.
Thank you.
Yeah.
Sharice Hamblin, thank you. If you could introduce yourself too, that would be great.
Hi, everyone. I'm sorry, I'm in my mobile office today. So I'll keep my camera off, but I'm Sharice Hamblin. I'm an OBGYN who'll be joining UMass Memorial in January. And this is such a wonderful and rich discussion, especially, I mean, I enjoyed the presentation a lot. The question answer is really kind of like, it's stirring me up and in the best way. To the discussion that was just going on about, you know, the system and thinking about it, I find myself really thinking about, I can have the best intentions as an OBGYN and the care that I provide patients can be top tier and all of this, but I am but one person and I have but so much impact in what's going to happen in the outcome of my patient. And when I put that into the context of outcomes for patients, that the whole entire healthcare experience is something like 20% of the impact on what happens for the patient. And I bring that to this discussion, and, you know, we have a person who is pregnant for something like, 10 months, and then they have an infant for 1 year. So when I think about the decisions to decide to, how are you going to feed your child, that education and that decision making and kind of bolstering what is your rationale for it, your understanding of it, your commitment level, how are you setting yourself up for success, how are you engaging resources, all of those things are happening throughout the pregnancy. And then the delivery experience is somewhere between 1 and 7 days. Even if you're induced and then end up with a C-section, like this is still a self-limited thing. And I, of course, I can't speak anything about what the experience is, there, but it is self-limited. And then we go home, and what are the resources that we have, and how do we engage those resources, and how are we supported? And so I think that there's in understanding that the healthcare experience and the in-hospital experience is but a fraction of the impact. It's like, what are the places that we can actually exact change? Because I think moving big institutions is obviously very difficult, and not to say that it's impossible, but I like to kind of, I don't know, I just think about the point of saying, where do I have the most ability to make impact, and then working there and then moving out further, if that makes any sense.
Yeah, thank you so much. I appreciate that. And I'm looking forward to working with you when you get here to UMass. That's great. We just have learned that we have to definitely be out of this room by 10 o'clock. So I just want to probably wrap things up. I would invite continued discussion through email if you want to. Looking forward to the next meeting. So let me just move on with summarizing. For action items, there actually is a pump bill in the Massachusetts legislation right now. And I can stick this into the chat for how to submit some testimony about this.
We got Senator Kennedy to back that.
Yeah. And our own Senator Robert Kennedy is backing that. That's great. And then for action items, we are about due to have a strategic planning meeting for this group, and I'm gonna aim for doing that in March, I hope. So if you could hold the first Monday of March, we typically meet on the first Monday of every third month, in the morning, with the exception of September, where we will it's the second Monday, and we'll meet this year as we have been the last few years in a community space. So, stay tuned for more information about a strategic planning meeting. I really think, it's time for us to sort of look at all of these wonderful new opportunities and people that we have coming to Worcester and different kinds of funding streams and all of that, and sort of reimagine, if you will, where this group is gonna go and what we can do to continue to be part of this work. So, any other closing comments or questions? I'll just put this up again, if we can. Have the-
I didn't think we had time to read all the comments in the chats, but thank you, and it didn't look like anyone had a specific question, so I didn't read them.
Yeah. Great, and then if you can, fill out the, feedback, and what I'll do is we'll get the slides, and send those out in summary from this meeting with the feedback link too, to sort of encourage that. I know it's really easy to forget to do feedback once you're done with the meeting, but I'm sure folks would appreciate it, and we would love some feedback about future meetings, so. Thank you all, I appreciate everyone's work in this group, and wishing everyone a wonderful holiday season. However you like to celebrate, and however you like to celebrate winter, and, we'll see you next spring. Spring is around the corner, Dr. Hernandez, take care, everybody.
Yeah. That's